Hi everyone, this is the group at Truman State University, El Grupo, and we decided to look at America's opioid epidemic. The data that we were given was by Rocky Mountain Poison and Drug Safety Center from an online survey. We were given 5 files containing data from Canada, Germany, the UK, US 2018, and US 2019. The questions that our group decided to focus on was, how does the overall effect of opioids differ per specific groups? And is there one group that is more likely to misuse/overdose on opioids?
So there's a lot of different demographics that we looked at, such as age, race, gender, income, region, marital status, whether they were a current college student, and current healthcare professionals. So here we're looking at the demographic of income, and we're seeing on the x-axis whether they use or whether they have ever used prescription opioids, yes or no. So we can see here that there's not much difference, but as we go further and look at prescription opioid misuse, it shifts a bit. And then as we look at illicit opioid use, we see that poorer people are much more likely to be using illicit opioids than more wealthy people. Here's the same idea. We looked at marital status. The x-axis is the same, but on the colors, we can see that the marital status of the people. And here we can see with misuse, it shifts a bit. And with illicit opioid use, it gets a lot higher for specifically people who were never married, which is interesting to see. And then we decided to look at racial bias from physicians, because in our outside research in social science and medicine, research from Science Direct was done to look at interactions between physicians and patients of different races. They found Black patients were more likely to receive higher doses or stronger types of opioids for back pain when showing challenging behaviors than white patients who were showing the same behavior. So we wanted to look at demographic differences between specifically Black and non-Black people and white and non-white people based on that. So here we looked at Black and non-Black people, and we can see in the same order prescription opioid use, prescription opioid misuse, and illicit opioid use, which is actually very close to the same, which is interesting to see. And then you can see here with white and non-white people, prescription opioid use, prescription opioid misuse, and illicit opioid use as well.
So now we're going to focus on specific prescription opioid use, misuse, and the use of illicit opioids. We found in our outside research from the National Institute on Drug Abuse that some patients were prescribed opioids for severe pain. It is estimated that 4 to 6% who misuse prescription opioids switch to heroin, and about 80% of people who use heroin first misuse prescription opioid. This got us interested to see how this broke down in the data given our sample. So here in the first graph, we can see the counts of recipients of a single opioid dependency description on the x-axis there by most recent opioid prescription misuse. Here we can see across the board that not many people at all were prescribed these prescriptions, but they tend to have the same trend in which that there is still that general use of, if people have been prescribed these prescriptions, there's still that use of trend of misuse. And then when we look at counts of recipients of the same prescriptions by illicit opioid use, we can see a lot more people who are on these drugs tend to have a higher case of recency of misuse, which would bolster our outside research of how people misuse illicit opioids.
And to predict whether people would actually, patient would misuse any opioid, we used a number of factors. We did a logistic regression. So we had a full model which had gender, age, marital status, healthcare professional, income, student, whether they were in grad school or undergrad, region, and whether they'd been prescribed opioid. And so we decided to do that. And then we did a stepwise model to see which variables were significant. And we found that whether they were a student or not wasn't significant, but if we knew they were a student and what program they were in was significant. The IC for this one's very high, so we decided if we could predict illicit opioid use. And for this one, our IC is actually a lot lower. It's actually negative. And the most interesting thing about this is that the, again, student was significant, but if the Black only this time was also significant, but white only wasn't, and it was negative. So we predict that if you select Black only, you are less likely to abuse illicit opioids. And this is our works cited. Thank you. Have a nice day.